Hi, this is Dr. Rena at CVD Kids Dentistry, and this is part 2 of our tooth pillow video. So this is one of our tooth pillow cases, and as you can see here, she has an underbite and a right crossbite. So a crossbite is basically when the upper arch is not developing like we want it to, and we want the upper arch to be wider than the lower dental arch. And here you can see that her right side is actually indented into kind of like the lower arch. And so what causes a crossbite? So things like extended pacifier use, extended thumb sucking, or a tongue tie. And that's exactly what this patient has. So she is 5 years old and she's been sleeping with her tongue lowly postured in her mouth for the past 5 years. And so what that means is that she's been mouth breathing. And with mouth breathing, she's also thrusting her tongue forward while she sleeps to gain airway space. And that is what's creating her underbite, as you can see here. So her lower jaw is constantly moving forward with that tongue thrust habit that she's developed to create that airway space in the throat so that she can sleep and breathe better. Mom has reported lots of mouth breathing throughout her life and snoring, unfortunately. So in order to fix this, we had her sleep with a tooth pillow in every night, all night, and 1 hour during the day to help really train those tongue and cheek muscles to properly function. And after 5 months, these are the results. So you can see here that she is sleeping better and breathing better, and her teeth are telling the story of how well she's breathing and sleeping at night, because you can see that her underbite is much better now. So her teeth have shifted properly, her upper jaw is growing more forward now, and her tongue is no longer thrusting her lower jaw forward. Another cool thing that you can see is that her crossbite has significantly improved just in 5 months. And the reason for that is because her tongue is instinctively resting on the roof of her mouth because of the tooth pillow and that little tongue tab that's installed in the tooth pillow. And so with the tongue resting on the roof of her mouth while she's sleeping, it's creating that lateral and horizontal pressure to the upper jaw. And so it's able to be expanded out of crossbite. And we're not even done with the case yet. What's super cool is you can actually see that her profile has changed significantly. Her lower jaw has stayed the way that it is, but her upper jaw has developed more forward to create a more straight profile, whereas before you could tell that her chin was way too prominent and her upper jaw was underdeveloped. Now let's go through an overbite case. So as you can see here, this child presented to us. She's 9 years old and she has a very deep overbite, and mom reports breathing through her mouth at night all the time. So our goal was to decrease her overbite and unlock it, which means that once we decrease it, the lower jaw is able to grow forward properly. So right now she's like this, and we want it to be like that. So in just 4 months of wearing the tooth pillow, this is how she came to our office. The overbite has been significantly reduced, and you can tell that her teeth are starting to space a little bit. So the crowding that you saw originally is getting much, much better. So just from the tongue being positioned at the roof of her mouth and exerting that lateral pressure on her upper jaw, not only is it exerting pressure on the upper jaw, but also the lower jaw is actually following it. So she's able to be a little bit expanded. And we will follow up her case with an expander that she'll be in for the next 6 months, which will 100% create that, that expansion of the roof of her mouth. But as the roof of her mouth gets expanded with the tooth pillow and the expanders, it'll also drop and her nasal cavity will expand in volume so she can breathe better through her nose when she sleeps. Thankfully, the mom has reported that she's no longer mouth breathing and she's no longer snoring. So these are some great results. Follow us for more cases like this, where you'll be able to see us changing kids' lives with just a simple tooth pillow device.